Did you know that in the United States, someone has a heart attack about every 40 seconds? Recently, there's been a worrying increase in heart attacks, especially among younger people and women. Experts say that cardiovascular diseases, like heart attacks, cause more than 17 million deaths each year. The scary thing about heart problems is that they often sneak up on you. We might not realize there's a problem until it's too late because we don't always know the early signs of a heart attack. Today, we want to talk about why more and more people are having heart attacks, especially younger folks, including both men and women, even if they didn't have any signs of heart trouble before. Heart attacks can happen out of the blue, which is why it's so important to be aware and take care of our hearts. So stick around as we go through 7 signs that your body might show before a heart attack and why it's important to pay attention to them. And remember, if you notice any of these signs, don't hesitate to get help from a doctor right away. 1. Fatigue or shortness of breath. Feeling unusually tired or experiencing difficulty breathing, especially after minimal physical exertion, can be an early indication of heart disease. If you notice yourself becoming exhausted more quickly than usual, particularly without any other apparent cause, it's essential to take heed, especially if you have other risk factors for heart problems. 2. Cold sweat and paleness. Sudden cold sweats and paleness, particularly if they occur frequently and without obvious triggers, could signify underlying heart issues. These sweats are distinct from those caused by heat or exercise, often feeling sticky and cold and accompanied by chills. Recognizing this symptom is crucial, as it could be a sign that your heart is in distress, necessitating prompt medical attention to prevent a potential heart attack. 3. Jaw pain, especially on the left side, might serve as a warning sign of a potential heart problem. Due to the complex network of nerves in our bodies, pain from the heart can sometimes be felt in other areas, including the jaw. Persistent or unusual jaw pain, particularly when combined with other symptoms, should not be ignored, especially if you have other risk factors for heart disease. 4. Digestive discomfort. Experiencing stomach pain, bloating, or discomfort, especially after meals or during physical activity, could indicate underlying heart issues, particularly if you fall into a high-risk category for heart disease. This discomfort might resemble digestive problems such as gastritis, but does not respond to typical treatments. Paying attention to these symptoms, especially if they are new or worsening, can aid in the early detection and prevention of heart problems. 5. Back pain. Persistent back pain, particularly between the shoulder blades or on the left side, may be a sign of problems with the heart or aorta artery. Unlike typical muscle soreness, this pain does not improve with rest or self-care. If you experience intense or unusual back pain, especially if it's a new symptom, it's crucial to consider the possibility of a heart or aortic issue and seek medical help promptly. 6. Numbness of the left hand and arm. If you've experienced slight pain or numbness in your left arm and hand, particularly during activities like walking or climbing stairs, it could be a potential warning sign of heart issues. While various health problems can cause numbness, it's essential to consider the context, especially if you have risk factors for heart disease, and if there's no other logical explanation for this sudden change. Consulting a cardiologist is crucial, especially if you're at risk for heart problems, as this symptom may indicate underlying cardiovascular issues that require immediate attention. 7. Dizziness. Beware of sudden dizziness or feelings of faintness, especially if they've started recently and occur during physical exertion, like walking or climbing stairs, or even while eating. These symptoms should not be ignored, as they could be indicative of significant heart issues. Patients experiencing such symptoms may undergo cardiac catheterization, a diagnostic procedure that can reveal potentially severe blockages in the coronary arteries. Recognizing these signs early on is vital, as it can lead to timely medical intervention and potentially save lives. We must address the root causes of heart disease by making lifestyle changes and adopting healthier habits. Whether it's quitting smoking, managing blood pressure and diabetes, adopting a balanced diet, or staying physically active, Every action we take towards improving our heart health matters. Together, by spreading awareness, prioritizing prevention, and making conscious choices in our daily lives, we can work towards reducing the prevalence of heart disease and ensuring a healthier future for ourselves and generations to come. Let's commit to nurturing our hearts and embracing a lifestyle that promotes longevity and vitality.